On the 2nd of February, the patient's diet was a GI soft diet. His estimated needs were unchanged from previous, and his caloric and protein intake met less than 75% of estimated needs and an unknown amount of his estimated fluid needs. At this point, the patient had a new nutrition diagnosis of severe acute injury or disease-related malnutrition related to surgical intervention for perforated appendix, poor PO intake, chewing difficulty, and poor wound healing, as evidenced by the medical record, patient interview, and poor dentition, as well as a nutrition-focused physical exam. The nutrition intervention at this time was to note the patient's food preferences and allow the patient to request snacks between meals, to give Juven twice a day for wound healing, Bena-protein added to food in each meal to, again, help with the wound healing because protein's so important in healing wounds, and monitor for tolerance and change in status. His next follow-up with the dietitian was on the 7th of February. And at this time, the patient reports that he struggles to eat well. He has poor appetite, but is still eating 50% of his meals. He tolerates some Ensure on leave, and he usually drinks less than half a can between meals. He agrees to try Juven again, but per nursing, he is not compliant with the Juven, and he's not even taking it once daily. So that's not helpful for his wound healing. And his weight, it's uncertain whether his weight has changed at this point since admission because no bed weights were recorded since his admission. He continues at this point to be on a GI soft diet with unchanged estimated needs from previous. His nutritional intake meets less than 75% of estimated calorie and protein needs at this time, and an unknown estimated amount of his fluid needs. The plan at this point was to follow up and encourage the patient to be compliant with medical nutrition therapy, to eat his food because food is important for healing, and to take his Juven because Juven is so helpful for those surgical wounds and his wounds on his legs. The next nutrition follow-up was on the 10th of February. The patient is day 1 after another exploratory laparotomy, and he is in ICU at this point. So they did a third exploratory laparotomy. He has TPN number 2 ordered to start today, and he complains of pain, abdominal pain post-surgery. He states that he's in a lot of pain. His weight change, he had a 59.5 kilogram bed weight measured in ICU on February 10th. And so if this weight is accurate, that means that the patient lost 20% of his weight in a month since admission, which is quite significant. The next follow-up for nutrition after this third surgery was on the 16th of February. Per the nurse, patient is drinking his Juven, so that's helpful for the wound healing, but he's continuing to eat less than 50% of his meals. The next follow-up showed that patient was intubated over the weekend, and this follow-up, nutritional follow-up, was on February the 21st. So the patient was intubated, and he is still receiving TPN as his only source of nutrition. He appears very thin and malnourished, and the nursing reports that he has possible stool oozing from his wounds. So that contributes to infection, and his wounds just at this point are not healing properly. His BMI is 22.37 with a weight of 74.84 kilograms. But this is based on his initial weight at the beginning of his stay. So his weight changed actually to 64.5 kilograms. But there's a questionable accuracy of the bed weight based on whether or not things had been placed on the bed, whether or not the patient actually had lost that much weight. The patient had been previously declining steadily in weight to 53 kilograms on the 18th of February when he was moved to ICU. His bed weight increased by 11.5 kilograms. So there's a likely equipment placed on the bed, or the bed was not properly zeroed out. And so there's still concern for the 20 kilogram weight loss since the admission in January. Looking at the patient is intubated and sedated. There's bruising noticed on his skin. For gastrointestinal, he's receiving TPN, and he has surgical wounds. He has bilateral lower extremity wounds and blackened skin on his legs. The nutrition-focused physical exam here reveals severe muscle depletion, noted in the temporalis, clavicles, and hands, ribs, and scapula. Severe buccal fat loss is noted in the face, and severe loss is noted in the triceps and the ribs. And he has surgical wounds. The recommendation at this point was to increase the protein in TPN to 125 grams. And this is recommended to the doctor, and give amino acid 10%, 1250 milliliters, and just see if that makes a difference in his wounds. At this point, at this hospital, the doctors are the ones to order the TPN, so the dietitian makes recommendations, and then the doctor can choose to follow those recommendations. The monitoring and evaluation and goals at this point were to tolerate the parenteral feeding within 24 to 48 hours, and that's an ongoing goal. Another ongoing goal is to have nutrient intake meet over 75% of estimated needs within 24 to 48 hours. And a third goal is to promote wound healing throughout length of stay, which is ongoing. His discharge needs are too soon to determine, and after this final nutrition assessment, the family came to visit the patient, and it was decided that the patient needed a terminal extubation, which means that the patient would be removed from the machines that had been keeping him breathing and alive. And so after they did the terminal extubation, the patient passed away after 5 minutes of being off of the machines.